HealthWish is a series of conversations about the state of healthcare in New York City's fabulous fifth borough, Staten Island. Our goal is to raise issues, raise awareness, and raise health. Because when we raise health, we raise everyone. Colon cancer is the third leading common cancer. Northwell Staten Island University Hospital has a center for advanced colorectal care, and Staten Island's own Dr. Bonomo is leading a team of experts for world-class care. Give it a listen.
Just because I still hear all the time from folks, wait, I'm not 50 yet, I'm not getting my colonoscopy, I think it's important to note, when did it change to 45 years from 50, and why did it change? Because I think the why is actually in many ways more important than the when.
Absolutely. So it changed in 2018, and that's because we were noticing a trend towards higher incidence of colon and rectal cancer in patients below the age of 50. So if we left the age of screening at 50, those patients would be missed. So we wanted to move it earlier to 45 to capture more of those patients. And the reason, like I was just mentioning, is because there's a higher incidence of colon rectal cancer in younger patients, and the mortality is actually higher in that population because of that, because they're not getting diagnosed until a later age.
So too many people were coming in at 50 getting their first scope, and they were finding stuff that was already well too late staged than they would have seen, or getting diagnosed when they had problems instead of getting to 50.
Absolutely.
So by pushing it forward, and by getting this done, your likelihood of actually having a late stage thing that could potentially take your life goes down dramatically.
Absolutely. So early stage colon and rectal cancers are asymptomatic. Unless you go looking for it, you won't identify it. And I think that's important because a lot of patients that I speak to will say, I feel fine, I have a good diet, I exercise, there's no blood in my stool, I don't have any of these concerning symptoms, but even without all that, you could still potentially have a colon rectal cancer. Luckily with colonoscopy, we can identify them.
Talk to me a little bit about the procedure itself. I know that, like a lot of other fields of surgery, procedures have slowly changed. Tell me a little bit about how the procedures that you do have changed.
Absolutely. So one of the things I also liked about colorectal surgery is the innovation. I'd say probably 30 to 40 years ago, a lot of the surgeries that were being done all open, and then there was the introduction to laparoscopic surgery, meaning surgery where you make small incisions in the abdomen without having to create a large incision in the abdomen. And this was shown to have a significant improvement in outcomes from the surgery. As that has evolved, we've moved towards less and less invasive, less time in the hospital, less pain, less blood loss, to try and make the surgery as small of an impact on your day-to-day life as we can. And the next iteration of laparoscopy has now moved on to robotic surgery, where now we have the luxuries of binocular vision, depth perception, we have wristed instruments on the robot, we have special tools like indocyanine green. We can use a special wavelength of light on the robot to see perfusion of the tissues in real time. And all these things allow our surgeries to be more efficient, less invasive, more accurate, and ultimately, at the end of the day, better care with less impact to the patient's quality of life.
Yeah, it's changed so much. I mean, I remember when I was doing my surgical rotations as a medical student, people were using scopes to do gallbladders. And to be where we are now, where you're only talking about a couple of decades that they started doing some of these bigger cases through a scope, it's really, truly amazing. Just highlight for me exactly, how is doing it robotically differently, and why is it not always the best thing to do?
Traditional laparoscopy, the instruments are long, thin, fairly delicate instruments that can rotate, but really that's about it. Currently on the robot, the visualization itself is better. It's high definition. Also, it allows for better handling of the tissue because we can see structure is better with this very high definition vision. We can zoom in, you can get a 10 times zoom image. You can really make sure what structures we're looking at, what we need to protect, what needs to be removed in order to get a good cancer surgery. So in terms of when the robot is not the best option for a surgery, it all depends on what we're trying to accomplish. The robot is just another tool, and each tool has its purpose, right? And the robot has allowed us to do a lot of complex surgery, especially in tight places, but sometimes for very, very minor procedures, the robot might be more than what's needed.
I think one of the neatest things is, I know if you're looking right now, if you're watching right now, with Dr. Bonomo, he may look like he's very, very young. He's not actually that young. You've been doing this for a little while, but we were very proud of the fact that you were recently honored as one of the 40 under 40 on Staten Island in recognition of all the amazing things that you've achieved under the age of 40. So congratulations. I know you're getting really close to 40 at this point. Tell us about that.
So I came to Staten Island Hospital in 2019, and when we came here, we really had a lot of support from the institution, from Northwell, to really create a program for colorectal surgery patients to provide excellent care at the highest standard and to provide minimal impact on the patient's quality of life. So through that, we were able to develop our Advanced Colorectal Care pathway, where using the knowledge we have about the enhanced recovery after surgery programs, as well as minimally invasive surgery, pre-op, intra-op, and post-operative care, we've been able to decrease our length of stay, decrease our complication rate, and increase the patient's quality of life and outcomes from colon surgery. And I think that's something that we're really proud of.
So tell me what's new in the world of the center in Staten Island and what's going on with colorectal surgery. I know there's some new things going on.
Absolutely. So our Advanced Colorectal Care pathway has recently been designated a Center for Advanced Colorectal Care at Staten Island. We've been able to get that designation through our team of advanced care providers that are able to help navigate the patients through the medical system. Being diagnosed with colorectal cancer or being told that you need a colon surgery can be a very harrowing experience. There are no delays to care. The vast majority of our surgeries that we do here are all minimally invasive to take advantage of those benefits. And as well, post-operatively, when you're on the floor, you're getting all the necessary things that you need to make sure that you have a good recovery. So physical therapy, you make sure that all of your medications are appropriate, multimodal pain medications to make sure that you're comfortable, to reduce your risk of complication after surgery.
The old days of getting diagnosed with something, going to see a doctor, and then figuring the rest out, those days are gone, right? Like
Absolutely.
So, like a team approach, and really kind of a group of people that are helping take care of you, from the surgeon through the advanced care provider, and all the way down the team and the people that help you through the process. It's huge.
Absolutely.
Yeah.
So just about every department within the hospital is involved in the center, making sure that you're getting everything that you need so that you can have a good outcome.
Thank you for that. And I think it's really special. And I really wanted to end this episode talking specifically to the folks in Staten Island that are listening to this and watching this. If you have a young one in your family who you're connected to, who has aspirations of doing great things, it doesn't matter what those things are, right? What matters is that you can do it here. So Giovanni is a kid from Staten Island who actually is now the premier provider of anyone who actually has colorectal cancer. I came back here to run an emergency department, and I now run a hospital on Staten Island in a place that I'm incredibly proud of and that I love incredibly from the bottom of my heart. Encourage your kids, encourage the kids in your life, encourage the young adults in your life to think about this place as a long-term career. Why can't one of our children come back here and have the architect who designs the next wave of what buildings look like in the public areas of Staten Island be from here? And the answer is we can, right? But that requires us encouraging and feeling about this place the way I feel about this place and the way so many of us do, and the pride and the knowledge that you can make a career here. Why can't they do them here just like Giovanni?
Yeah, absolutely, I agree.
Thank you so much for this.
Thanks for having me.
Truly a pleasure.
It's good talking to you.
HealthWish wishes to thank our special guests, Dr. Ardolik and Dr. Bonomo. We're very interested in your health wish. Contact us at healthwish@northwell.edu. Thanks for joining us. We hope to see you again soon.